Welcome to The Explainer. So, are you dealing with some of that nagging joint pain, maybe in your back or muscles? Well, you are definitely not alone. And today, we're going to break down exactly how Medicare can be your partner in getting the relief you really need.
Yeah, let's just get right to the big question, the one that's probably on your mind. Can I actually get help for this pain, and can I afford it? Well, I've got good news. The answer is a big yes, and we're about to show you exactly how.
Okay, so here's our game plan. We've broken this whole thing down into 6 simple sections. We're going to go from talking about the pain itself all the way to a solid action plan for you. So let's just dive right in.
All right, first things first, let's talk about the problem. Acknowledging what you're up against is always the first step to finding a real solution.
Look, if that pain is making everyday stuff harder, the most important thing to remember is that you are not in this by yourself. I mean, we're talking millions of people in the exact same boat. But here's the good news. There is a clear path forward.
Okay, enough about the problem. Let's talk about the good stuff, the solution. This is where Medicare really steps in to become your partner in getting better.
And hey, don't just take my word for it. This comes straight from the source. Medicare's official goal, their whole purpose here, is to help you reduce your pain and get your function back. It's a benefit that's literally designed for your recovery.
Physical therapy isn't some secret, hidden benefit you have to hunt for. Nope. It's a core part of your standard Medicare Part B, your medical insurance. Bottom line, if your doctor says you need it, you are covered.
So, how do you actually get the ball rolling? Well, it's actually a pretty simple and straightforward process. Let's walk through it, step by step. All right, here we go. There are really just 4 key steps to get your therapy covered. Step 1. It all starts with your doctor. They have to certify that you actually need PT. Step 2. You and your therapist will create what's called a plan of care. Think of it like your personal roadmap to recovery. Step 3, and this one is super important. Make sure your therapist accepts Medicare assignment. You do not want any financial surprises down the road. And finally, Step 4. You start your treatment and your progress gets reviewed along the way to make sure everything's on track. Okay, listen up because this next part is maybe the most important rule of all. Understanding this is the key to unlocking your benefits and making sure everything is covered. And that rule comes down to 2 little words: medically necessary. You are going to hear this phrase a lot when you deal with Medicare, so let's break down exactly what it means for you.
So what does medically necessary actually mean? Well, in plain English, it just means that the treatment is needed to diagnose or treat your specific medical condition, and it follows accepted medical standards. So let me give you an example. Physical therapy to rehab your knee after surgery? Absolutely medically necessary. But say a general gym membership just to stay fit, that's more for general wellness, so that wouldn't be covered. See the difference? It has to be targeted treatment for a diagnosed problem.
All right, let's break this down a little more so there are no surprises. On one side, you've got the stuff that's pretty much always covered, the basics like an evaluation, therapeutic exercises, that kind of thing. But on the other side, these are the things you really need to double-check with your provider. We're talking about specific things like ultrasound or maybe some medical equipment for your home. It's not that they aren't covered, but you'll just want to confirm that they fall under that medically necessary rule for your specific case. Okay, let's talk money, the bottom line, right? Understanding what you'll actually have to pay out of pocket is so important. And the good news is, it's actually pretty straightforward. First up is your annual Part B deductible. Now, this is the amount you have to pay out of pocket for your medical care each year before Medicare starts paying its share. And hey, if you've already had some doctor's visits or other services this year, there's a good chance you've already met it. Once that deductible is met, it's really simple. You typically pay 20% of the Medicare-approved amount for your physical therapy. So think of it this way. Medicare picks up 80% of the bill, and you're responsible for the other 20%. Pretty simple, right?
And I have some really, really good news for you. You might have heard stories about these old therapy caps, these annual limits on how much Medicare would pay. Well, they're gone. That's right. As long as your doctor and therapist show that the PT is still medically necessary for you, your coverage will continue. That is a huge deal.
All right, we've covered a lot. So what are the next steps? Let's put all of this information into a simple action plan that you can use to really take control of your recovery.
Here it is, your checklist to get started. First, talk to your doctor. Don't be shy. Be specific about your pain and ask them straight up, is physical therapy right for me? Second, ask for a referral to a physical therapist who you know accepts Medicare. Third, and I can't stress this enough, before you start any treatment, call the therapy provider and confirm your coverage, just to be safe. And finally, keep good records of your visits and the progress you're making. It's a great way to be your own best advocate.
So, there you have it. You're now armed with the information you need to take that first step toward managing your pain. Are you ready? You know what your benefits are, you've got a plan. Now it's time to take action. Go get the relief you deserve.